Hi everyone. Hi Amr.
Hi everyone. Hi Mirna.
How are you today, Amr?
Fine, I'm good. How are you?
I'm wonderful. I'm wonderful. I had such a productive day working, and now I'm so excited to see you so that we can spread many important messages for our community at large. And the topic is integrative oncology. So before we go into the details, I'd like to say that meeting you has been truly a joy. We know each other from AUB, our beautiful university, and you work at AUB as a registered nurse in oncology. So please take it from here, Amr. Tell me about you and tell us all about you as a person, as a career person, as whatever you like.
Thank you, Mirna, for the beautiful introduction. First of all, I'd like to introduce myself. I studied nursing at AUB, and since I graduated, I started to work with oncology patients at AUB MC. And then after that, I took a hypnotherapy course, and after I finished the course, I started to integrate hypnotherapy practice into my nursing practice by giving the oncology patients certain suggestions that would help them overcome their symptoms and their disease in general.
That's fantastic. And when you give your oncology patients those suggestions, do they have to be asleep, or is it like in general it affects your whole approach and attitude with them?
Not necessarily. I usually use this approach all the time because sometimes during the shift I don't have the time to do a proper session, but I try my best to give them some suggestions, give them some tips that they can use on their own so it can help in their healing. Because sometimes we usually neglect the mental health aspect of the patient, so I'm trying my best to tackle this topic.
Yes, that's great. I really have to say that you've always cared about the mental health of your patients, and this is what actually, joins us together. It's our passion for holistic approaches, and that for a patient to be healthy, for any person to be healthy, really, we need to focus on the mind and the body and the soul, since we are not only a body, right?
Yes, I agree.
Yes, fantastic. So, what are you doing like for yourself to stay well during these very challenging times that we are living?
Hmm. So yes, indeed, those are very. This is a very challenging time. So what I'm trying to do is I'm trying to benefit from the free time that we have at home. I'm trying to do a lot of activities that I didn't have the time to do. Trying to finish books that I really like. So books about history or any topic that interests me, like to keep my mind off from negativity.
As a distraction, yes,
Distraction.
definitely a healthy, positive distraction is very much needed during this time. Amr, I agree. So, like for a lot of people now who are undergoing treatment, chemotherapy or radiation, what's your take on that really? Like during Corona, they are immunosuppressed, they are compromised. What is it that you tell those people, Amr? What are you noticing? What are they really going through right now?
What I'm noticing right now through my experience these days is that people are getting very anxious because they're afraid that they might catch the virus because they're compromised, and any infection that they catch is causing them a lot of problems. And what if the infection was coronavirus and we don't have a treatment for it? So what I'd
Yeah.
like to mm, so what I'd like to offer for such patients is I would like to tell them to calm down, and to take the necessary precautions, like to go out definitely with the face mask, only for necessary trips, like going to take their treatment. This is the only
Treatment.
necessary trip that I think they
Mhm.
have to leave the house. Other than that, if they can delegate anything like grocery shopping or anything else, they can delegate it to their family members, so they cannot risk themselves. They
Yeah,
should
this is such an important tip, you know. It's very important, as you said, to develop a mindset of calm and peace. I know that many people hearing us, if they're especially diagnosed with cancer and are undergoing treatment, when we say like stay calm, they would say, ah, it's easier said than done. This is why it's very important for them to reach out for help on techniques, on tips, on how to develop calm amidst the chaos. So that's important. And you know, a very important word you said, Amr, that I'd like to emphasize again is delegation, especially when patients are diagnosed with cancer. Some of them, they refuse, you know, to feel weak because of their diagnosis, and I see that a lot in my practice. Like let's say she's a woman and she's in her 40s, she's been a housewife for quite some time. She would even refuse to delegate cooking a meal to her daughter, let's say, or she would even refuse to call for a delivery because she doesn't want to send a message to her family that she is not capable or that they can no longer depend on her. So this is what we call as well in mental health, like personalization, or jumping into conclusions or assuming that the other person would feel this way or think this way. So Kameen, this is something I think that's very important.
Yes.
Delegation is very important to really teach yourself that even if I have cancer, I can, you know, of course, I can be dependable. Even if I need
Mm,
to rest on certain days, I can still delegate. And even if I delegate, you know, it doesn't mean that
mm,
I am weak. I'm still in control, I'm still strong. So, excellent advice, Amr. And what
definitely.
else do you have on your mind as well? What would you like to say more about this?
Definitely. But before I add something, I also want to emphasize on something about being strong. Like you said that the patient might feel that he's weak, but actually he's not weak. Like I want to say to all the cancer patients, you are strong. You are very strong. What you're passing through, how you are fighting this disease, like being there for your family members, like waking up every day fighting the disease. This is more than enough. Like this should be a positive note that you can fight this disease, and even if you cannot do something, that doesn't mean you're weak. It just means that your body needs rest, like you're helping your body to overcome this disease.
Absolutely, absolutely. And feel entitled, you know, to this rest. Feel that you can rest now, and the next day you will wake up more refreshed. You know, this is also a suggestion that I give in hypnotherapy. So it's really giving yourself the ability to rest rather than thinking that you need to always be on drive all the time and exhausting your system. So what we do as well is we teach right the cancer patient to listen and to honor the needs of the body rather than neglect them and be really busy with the needs of the family and other people around them. So yeah, um,
Yes, definitely, I agree. Oh, and
wonderful. So is there anything you'd like to add on what you were saying, like tips?
nothing more in general, just to take the general precautions, and not to not to have any visitors unless it's something necessary, and they would be fine. Now technology is facilitating everything, like virtual meetings, and so they will have the opportunity, like to contact everyone. so they won't get bored.
Yeah. Yeah, absolutely. Yeah, is there like anything, Amr, that you'd like to discuss or to ask me about?
Yes, of course. I wanted to ask you, how did the pandemic affect you personally and the center and your
Oh,
colleagues?
yeah. So for sure, the pandemic, we definitely need to admit that it has been stressful. And when it comes to the center, of course, for the safety of our clients, we closed the center. Um, I only go there like around once a week to keep it clean and all that, and to take care of my plants and
Mm.
you know, the orchids that are there, and they are now starting to grow.
Wow,
So
that's
basically,
interesting.
yeah. So basically, of course, I want my clients to stay safe. And as well as we know, this pandemic has been triggering a lot of anxiety. So many clients are opting to stay home. And so I'm resorting to tele mental health, or we are using like platforms such as Zoom, WhatsApp video call, just to really be there and to, for the sake of the continuity of care rather.
Mm, that's
Those
great.
are very hard times, and it's important to continue the care no matter, you know, the pressure, the lockdown. We cannot really allow this to stop the care.
Mm, definitely, you're right. And another question, I would like to learn more about this telemental health that you just mentioned. Can
Yeah.
you talk more about it, and and how do you find it? Do you find it effective more than the approaches that you used to use before the
Mhm.
pandemic?
So this is not really the first time. Thank you for asking, Amr. This is not the first time that I use such platforms or applications. My clients, many of them, they travel a lot. They're always on the move. They're businessmen, so they travel a lot. And due as well to myself having a lot of connections in the US and Europe. So I've always been offering services in terms of telehealth. That's not the first time. For me, of course, it's quite effective, and this is what clients also say. And some clients, they do experience both ways, be it live in the clinic with me or through a screen. And it's been really quite effective. And as long as you know, the confidentiality is there, as long as the unconditional support, positive regard, so those pillars that really are the foundation of a healthy relationship are there, despite it being through a screen. So definitely it's effective. However, of course, when the person is live, sometimes touch is important. Of course, we need to ask our clients first before we touch them, especially when they're experiencing any type of catharsis or release of emotions. However, you know, that's not there, but it doesn't mean that the session is less effective, because it's not.
Wow, that's very interesting to hear about. I didn't know you used to use this telemental health even before this pandemic.
Yeah,
Great,
yeah.
great job.
Thank you, Amr.
And one more thing, it's a question. It's a question for you at a personal level. How do you cope? And how do you cope with stress these days, like with with the lockdown and everything?
Hmm. I'm someone usually who I have a fast-paced lifestyle, so I'm always on the go. I do many things. I have many hats. as you know. So it's always been stressful for me, more of the positive kind of stress rather than the negative. So my meditation practice is there. Definitely a minimum of twice a day. I'm always doing self-hypnosis in between clients. And of course, I lead quite a very healthy routine in terms of what I eat, when I eat, certain supplements, you know, to support my my body, so that I don't end up having like adrenal fatigue or any type of negative stress. So I always support my body with the right activities or the right supplements. So it's really, again, a holistic approach. I really walk my talk. So whatever I recommend, usually I definitely would be trying it first on myself for my own well-being. And definitely, Amr, I'd also like to touch base on my approach with oncology patients as well. So oncology has always been a very interesting area, field for me. And that's why, in terms of my practicum experience and my doctorate in mind-body medicine, I traveled to New York to ICANN School of Medicine, Mount Sinai Hospital, and I did a lot of training on integrative, you know, oncology when it comes to the treatment of patients in terms of radiation, in terms of like when mental health needs to start, like even like as soon as the treatment starts or as soon as the diagnosis is made. It's quite imperative to look at, you know, stress management, nutrition, boosting the immunity. And I've been trained in a beautiful modality that combines CBT with hypnotherapy, specifically tailored for the unhelpful thoughts that cancer patients would be having in terms of all their journey when it comes to cancer, be it the diagnosis, the treatment, and everything related to it. So basically for me, most cancers starts by the age of 20, and of course as we age, you know, toxicity increases and genetic damage would develop, and it's all connected to inflammation as well. So in my program and how I deal with cancer in general, of course, I look for potential root causes. As I said, inflammation plays a big part. And as well, we really talk to the cancer. It's like when we give cancer a voice and we ask the cancer, like, why are you here? Till when do you want to stay here? What are the lessons that you need me to learn so that finally we can break up? So it's really very deep work. That's quite very beneficial because, of course, it ends up improving the quality of life, improving self-awareness, and definitely decreasing the side effects, the many side effects that come as a result of chemo and radiation, be it nausea, vomiting, any type of upset stomach, or when it comes to the appetite, you know, the weakness, the tiredness, that usually the fatigue and all those symptoms. So hypnotherapy really decreases those symptoms. So it's been really very, very fulfilling and very humbling, I'd say, to walk the journey with many cancer patients that visited Wellbeing Center. And the journey, you know, we will keep on walking it, and hoping that more and more, you know, exactly, like people need to be aware that healing, for it to happen, it really needs to be on a subconscious level, because the brain is always sending messages to the body. So when we give the patient a suggestion of that your body is healing or your white blood cells are working, functioning really to help you properly, suggestions really are very powerful. And now I wonder if you have something prepared for us that we would like to share with everybody, and we can also leave this beautiful interview with. So what would you like to share, Amr?
Yes, I would like to share something that I prepared recently. It's a small suggestion for cancer patients how to strengthen their immune system. So when they're gonna listen, I'm gonna ask them to close their eyes and to start to feel very relaxed now. You should feel your whole body relaxing. Now, I want you to continue relaxing, and you'll start to feel feel a very pleasant feeling as the relaxation spreads throughout your body. Now, you may not consciously understand how cancer works. However, your subconscious mind, there is no reason for it anymore. And now you are enjoying the pleasure of how your body is healing. And now I want you to continue imagining how your white blood cells are as you can see them. They are the soldiers, or you can imagine them in any way that you like, as nurses or anything that you like. They are clearing the cancer out of your body, patrolling your immune system, spreading strength and positivity throughout your body, making you strong.
Beautiful. Beautiful, beautiful. Yeah. Really. So we invite everyone to be aware that the mind is very powerful, and rest and relaxation and being open to healing and positive affirmations to keep them really mentally and physically, emotionally fit. That's
This is what
very
I tell my
important.
patient.
Mm-hmm.
The mind is the key for everything. Always think positive way. By positive, I don't mean necessarily fill everything with happiness, but I mean by positivity how to deal with negative situations. Because as we know, negativity attracts more negativity, whereas positivity helps us to overcome negative things and makes us stronger.
Absolutely. It's all about, coping positively, and really knowing that we're not alone. We are here, and it's really strong to be able to receive help. And we're in this together, and we will keep on walking this journey together. It's been wonderful sitting here with you, Amr. Thank you for all the tips and the insights that you shared, and hopefully we will keep in touch to keep
Thank
on
you, dear.
providing our community with the help and the resources that they require.
Yes, definitely. Thank you for this opportunity. I really enjoyed it.
Thank you, Amr. Have a good day. Bye-bye.
Have a good day. Bye
Thank
bye.
you. Bye-bye.